Good morning. After you've overcome the agonizing decision of treating ADHD with medication, I want to discuss how we pick the right medicine for your child, or for yourself for that matter. So, the most common question I get asked is, what is the best medicine? What is the most effective medicine? Which medicine has the least amount of side effects? Which medicine has the most clinical support for efficacy and side effects? What is the most commonly used medicine? Well, to explain how I pick medicine, I often make this analogy for the parents and for the family. I like to compare the different types of ADHD medicine to different flavors of ice creams because I like ice creams. And this is a very apt analogy. Just as, well, ask yourself this question first. What is the best flavor of ice cream in the world? I don't know. I would say it's strawberry. I like strawberry. I like fruity ice creams. You probably don't agree. You may agree, but you probably don't agree with all your family members. Well, just like there isn't one best flavor of ice cream in the world because each individual has his or her own preferences. When it comes to medicine, the selection is also very personal. Each person does well with certain flavors and not so well with others. So how would you know? Just like what you do at the ice cream store. When you walk in the ice cream store, what do if you don't know what to get? Well, they give you these little wooden sticks and then they scrape a little bit of flavor and have you try this. And you put one in your mouth and said, this is too minty. It's not for me. And you try another one and say, this butter pecan, pretty good, but I want to try one more. Then you get another spoon, you try something else until you reach the flavor that you settle for. And just like the medicine, there isn't really any way to know which medicine will work best for you until you try it. So just like what you do at the ice cream store, I will give you the lowest dosage of medicine and have you try the medicine and see how you respond to the medicine. I know this is trial and error. That's exactly what it is. I wish there's a more scientific way. In fact, there are companies that nowadays they operate with pharmacogenetics, where they'll look at your DNA and try to determine which medicine is most suitable for you. I've used some of these services before, but unfortunately they all fail miserably because we simply don't have enough data that can link your genome to the type of stimulants that may work best for you. So before we get any further, I also want to explain that there are two different types of ADHD medications. The two broad categories are stimulants and non-stimulants. Typically speaking, stimulants is where I go first because they tend to work much, much better. I would say about 85 to 90% of the times, I will be able to find a flavor of stimulants that works really well for you. But the non-stimulants, that's another story. They tend to have somewhat less side effects when compared to stimulants, but they also have a pretty poor track record on helping people with ADHD symptoms. For example, under the non-stimulant types, there is a common medicine that's called Intuitive. It's a blood pressure medicine that we found that can kind of dampen the hyperactivity in some children. It kind of mellows them out a little bit, but unfortunately it doesn't really help with children who need to concentrate better. So it just kind of lowers the activity level. Another medicine that's a non-stimulant is called Strateria or atomoxetine. This is a medicine that's initially looked at as a potential antidepressant, but it works very poorly as an antidepressant. But some people realize it can actually help people with ADHD. It also has a pretty poor track record. So for Strateria, I have seen this medicine work for some patients, but I would say only about less than 40% of the time that it can be beneficial. And also, this is a medicine that needs to be titrated up and titrated down, and it also comes with its own set of unique side effects. So one common thing you can already see is that you can't really escape side effects when it comes to using medicine for ADHD. Side effects is basically part of the deal. I will go into side effects in a separate video because that requires its own lengthy discussion. The most important thing I want to get across from this video is that picking the right medicine involves trial and error. And if we're lucky, we can hit the nail on the head on the first try. If we're unlucky, it may take us more than 6 months to find the right medicine. And also, the dosage of medicine, it's very individual dependent. It's not related to the patient's weight or the height or the age or the type of symptoms or the degree of symptoms that you may be experiencing. It has something to do with how fast your body processes the medicine. It has something to do with the metabolism. So I've seen little kids who require a tremendous amount of medicine, the highest dose, and I've seen pretty big kids in high school who just who do great with the smallest possible dosage for the medicine. So in order to find the right treatment, you have to find the right medicine and also the right dosage. So to find that combination takes time, and you have to be patient, and you have to be working with a clinician who has lots of experience working with patients and with these medicine. I've seen occasionally that pediatrician, they prescribe medicine based on weight. While most pediatric medicine dosages are based on weight, this is the one exception. These group of medicine, they're not weight based. So a lot of times, unfortunately, leads to people picking a dosage that's way too high for their ADHD condition. All right, so I think that covers the basis of how to select the right medicine. And another video, as I mentioned, will go over side effects. Have a wonderful day. Bye bye.